everybody, please stand for a pledge of allegiance and invocation. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Dear God, thank you for the light and the warmth. Thank you for the sun. Thank you for the gift of nature. And help us love and take care of our earth. Amen. Roll call.
Ms. Lees.
Here.
Mr. Bryant.
Here.
Mr. Beck.
Here.
I move approval of the agenda.
Second.
Roll call.
Mr. Bryant.
Aye.
Mr. Beck.
Aye.
Ms. Lees.
Aye. Old business. I move approval of Resolution G 2022-81, resolution authorizing the Township Administrator to enter into a contract with Medical Mutual of Ohio for providing health insurance coverage for the elected officials and full-time employee of Symmes Township.
Second.
Discussion.
Yeah, we don't know what policy we're going to go with yet. Do we?
Does someone, can we text Michelle and see where she is? Or should we call her?
Was she planning on attending, Kim?
Yeah, said she would be here.
Oh. I wonder if this is her calling me.
Is it on? Yeah, you got it.
It's a 614 area code. Is that where she's from?
That's
Yeah, she's from
Columbus.
Columbus.
Yeah, she's from Columbus.
Okay.
Oh, she says she
Oh,
thinks
she
she
went
has
to
the
the-
wrong address.
Yeah, she probably went to the township building.
Are you calling her?
Go ahead. I'm just listening. Yeah.
Michelle?
It's the same thing.
Oh. We're at 8871 Weekly Lane. So remember where you came to last year when we did the health, the big fire station? That's okay. That's what we're all like, where is she? And then we looked at our email and we're like, oh, she's lost. Yep. 8871 Weekly Lane. So if you went to our building, then you would just get back onto Montgomery Road, like turn left onto Montgomery Road, go down to the second light and turn right, which is Mason Road. And then you'll pass a nice building on the left, which is Hoarder Investments. And then that first street right there is Seven Gables. And then you pass that, so the second street on your left is Weekly, and turn left into that.
I'm pointing you. I was thinking about pointing you.
Okay.
Cut in the gray.
Oh, no, that's way down on North Lebanon Road.
So I think I might go if we don't get done. I forgot my map, so
Okay.
I'd have to go home. By the time I went home to get my map and get there, it'd be too late. So I think I'll go Saturday.
What time does it start?
Okay, well, if you're, are you on
6:30,
Lebanon Road
6:30?
then?
Mm-hmm.
Oh,
Yeah.
Loan you mine, but it's in the garage.
That's the
What?
one.
My map is in the garage. Sorry.
Okay, well, you can go either way. I would just plug it into your GPS and let the GPS tell you
I'll
which
treat
way to
myself
go.
to Chick-fil-A when I leave here.
There you go.
You can either keep going down West Loveland and
I move to take a recess until our health insurance provider gets here.
she plugged in the wrong safety center.
Roll call.
Mr. Beck.
Aye.
Ms. Lees.
Aye.
Mr. Bryant.
aye.
go back in session.
Second?
Roll call?
Ms. Lees.
Aye.
Mr. Bryan.
Aye.
Mr. Beck.
Aye.
Okay, we already read the resolution, so Michelle, would you like to tee up the explanation of that insurance for us?
Sure. So I sent that comparison that you guys all
Yes.
received. Just gives you a comparison of the option that was quoted, the Cozy Miwa option. I explained to a couple of you how that works. So the current plan is what they consider grandmothered. You right now aren't going to lose that status if you stay. A grandmothered plan is a plan that was written prior to the Affordable Care Act, but after the whole grandfathered clause. And there's some random dates that don't matter, but it was prior to 2014. The federal government said, if you like your plan, you can keep it. So that's what all these insurance companies have done, is provide what they call transitional relief or grandmothered status to keep that plan until the federal government says you no longer have that option. You're all going to be on an ACA, Obamacare, Affordable Care Act plan, whatever. Right now that keeps getting extended. So every year they extend it. We don't know at what point the federal government is going to say no more. We anticipate that it will keep getting extended until enough people have moved out of that transitional relief status because they can't afford it anymore, or whatever. So the insurance companies came out with these MIWAs. MIWA stands for Multiple Employer Welfare Arrangement, and I don't know how much of that was explained prior, but it's a self-funded platform, and each carrier, so Anthem, Medical Mutual, United Healthcare, all have an alliance with a different chamber of commerce. So Medical Mutuals is the COSY chamber, which stands for Council of Small Enterprises, and they do the self-funding. So they put up the money to pay your claims. You're paying a fully insured equivalent rate. If your claims run bad, let's say, they gave you these rates, but your claims exceed what they expected, you'll just see it in a renewal. You won't be asked to pay those claims. If the claims run well, you'll see it in a renewal. They won't give you a decrease, but their increases would be fairly low. So what they've done is because they have your history at Medical Mutual, they've looked at the medical conditions in the group, and they felt that you qualify for that program. They only put the best risk in that program, because if they put the high-risk groups in there, what's the point? So the point is to keep you in a program that doesn't force you to the so-called Affordable Care Act, Obamacare plans that are truly high-risk plans. Because there's no underwriting, there's no medical conditions taken into consideration. It's truly your age, your zip code, your plan, your rate. So if you asked, the business next door that may be on a $3,000 HSA plan with Medical Mutual on an Affordable Care Act, what's the price for a 45-year-old? When you got that quote, yours would be the same price. Okay. So these programs avoid you being forced to that Affordable Care Act, because self-funded plans cannot be forced to the ACA. Okay? That was just a lot of garbage thrown. So if there's questions, just interrupt me.
I had a question on the grandmother plan. I know what the increase is for the coming year. Is there a cap on the percentage of premium increase year by year?
No.
No cap?
No cap.
So it could go anywhere?
Right. So they look at the pool, all those groups and Medical Mutual. You're all kind of pooled together in that market segment. So you're in their pool, any groups renewing in August. And so they do kind of spread the risk upon. But I've seen groups get 30, 40% increases. There's no cap as far as what that increase could be. Now when you go to the MIWA, again, there's no cap, but you're all pooled in together, and you're pooled in with a lot of healthy groups, because those are the groups that they want in there. Where the grandmothered groups, You might have some really sick groups in that pool as well. And they just wanted to stay with that plan, that they have. So, looking at that plan itself, the deductible is the same, so it's that $3,000 and $6,000 deductible. Sorry, I have to put my little reader glasses on. And the plan has what they call after deductible copays, and those copays come into play on the prescription side. So when somebody meets that $3,000 deductible, an individual meets their $3,000 deductible, then their prescriptions change to copays. So they might then start paying a $15 copay for their blood pressure medication instead of, let's say, $100 that they're currently paying. Somebody that maybe is on insulin, I use that because I am, and it's expensive. Right now they might be paying $300 a month for it, but when they would go to, after they've met their deductible, they would then pay like $45 a month. So those copays are truly after the deductible. So one person, when that person can meet their deductible, then their copays kick in. The rest of the family adds up to the family deductible. So you might have, an employee hit their deductible, and then their spouse and maybe 2 kids, and all of their claims add up together to meet the family deductible. Or you could have a family that the employee meets the deductible and the spouse meets the deductible, or one of the kids meets the deductible, then everybody's covered and those copays kick in for everybody. Okay.
So is copay the same as out of pocket, that line?
So, no, the copays are down below where the prescription drug line, so where it says 15, 45, and 75. So when the out of pocket is that 6,900 and the 13,800. So that includes the deductible. So you have your $3,000 deductible, and then you're going to have $3,900 in copays until you have 100% coverage where Medical Mutual is covering everything. Okay? Where currently today you have the $3,000 deductible, which is the out of pocket. So when somebody hits their $3,000, they have 100% coverage by Medical Mutual. So, when you look at it, it does reduce the cost of the monthly premium. So it's going to be roughly a 1.8% increase instead of a 17% increase. The first column of that MIWA, I showed that if you fund it the way you do today for the employees to continue with that, only having $1,000 or $2,000 out of pocket, your maximum HRA liability would go up to the $177,000. And so those are the numbers that you have to show in your budget. You have to show that you can, fund the full premiums and then fund the full HRA, the health reimbursement, assuming everybody would hit the deductible. We know that's not going to happen because it just, like I said before, I've only seen it happen like on a 2-person group or a 3-person group. I've never seen it happen on a larger size group like yourselves. The way I did it was looking at the utilization is I took those last 5 years reports and I averaged them together based on the average of usage versus the average of the maximum, and came out with about $46,331, which is around 69% of the maximum for the current plan. When you go to that higher out of pocket, you're going to see you're not going to have a 69% utilization because it's going to take longer to get to that point, right? So I figured it around 35%. And again, it could be less than that. It could be more than that. We don't know because we don't know what could happen to somebody tomorrow or in 3 months from now. And so that's obviously just an estimated number of that 61,000. And then the second column, I did it just to show you if you kept the township's portion the same as only giving them $2,000 and $4,000, how much then they would have to pay out of pocket, and that would be that $4,900 or the $9,800. And I don't think that that's probably what you guys, the route you want to go. But, and that's always, you can adjust that to whatever. It doesn't have to be exactly what you do today unless there's a union involved that says it does. That number can be, that program is customizable to what fits your needs the best in your budget. Any questions?
I have a couple generic questions.
Sure.
Okay. The dollar numbers that we were quoted really come from a different broker?
Yes.
Okay. If you were to survey the same groups, Humana, United Healthcare, Ed Mutual, Aetna, whatever, would you get the same rates
Yep, absolutely.
because of the pool?
It's
And the experience of the pool?
Yes, as long as I provide the same information that the other brokers supply, we all get the same rates.
Okay, that was another question I've had for quite a while.
Sometimes, we can see that somebody will get different rates, and sometimes it's because, in the past you did form fire. Somebody did form fire, and then in the middle of switching it from one broker to another, somebody went in and made changes to their form fire that maybe made it look worse or made it look better. Then somebody could get different rates, but most of the time, I would say 90.
Based on the same information, you get the same rates.
Yeah, 99% of the time. And the carriers usually say, oh, wait, we got this in from so-and-so, and this is different on your submission. What's the difference?
But we've seen different rates from same groups, I think same groups anyway, on vision and dental.
So that can be different, maybe different programs. We have a consortium plan that we roll all public entities into, and so that's like 1,000 members, it's over 2,000 members in that program. And so we do get different rates than when you're just rated specifically on your own. And then the plan design, so if somebody shows a different plan option or a different carrier.
Okay. On the third and fourth PPO, 3,000 PD, RX, copay, whatever. The 15, 45, 75, 275 is the different tiers.
Yes.
What's the numbers underneath of it?
So that's the mail order. So if you do a 90-day supply through the mail order, that's
So it's
what
just
the
triple,
copays are. Yes.
except for the high end.
Yes. Yep, the high end stays the same because it's a specialty drug, so you have to go to a specific specialty pharmacy.
Okay.
You can't get, sometimes those are only mail order, but you can't get it, at different places. You have to go to a specific place.
Okay.
And those are usually extremely high cost medications. Anyone else?
Well, I'm thinking, there's more than one way to set something up, correct? For example, let's take the third column there, where the employer-funded HRA is going to be $5,900 or $11,800. Okay, to keep the employee out of pocket the same, correct?
Correct. Yes.
Okay. Now, if we were just to put X number of dollars into an HRA liability fund, just to cover once the deductibles have met, and then pay for the increased premiums for prescriptions out of that fund, could we do it that way?
So, well, I guess I don't really understand. You take that total out of pocket and you choose how much you want to put out of that total out of pocket. So what you want for the employees. So you could say, okay, we're going to fund your $3,000 deductible, and then we're going to fund $1,500 of the next $3,900 for those copays. Is that what you're trying to say?
Kind of, sort of.
Okay.
I guess I have reluctance to think about increasing the employer-funded HRA to these levels of 6,000, 12,000, if you will.
Sure.
When let's say we would exceed the current 2,000, 4,000, which is a fourth column, and then we would kick in, have to pay the co-pays on the prescription drugs. Okay? So
Yes.
we're setting the hoop here at 5,900, 11,800, when really all we're trying to cover is the increased liability to the employee after they've met the deductible, which is the drug and the
Okay.
four tiers. I'm concerned that maybe we're putting too much into this by going with a
Sure.
6,000, 12,000 plan.
So,
So I think what he's,
of the
what he's trying to,
$3,900 additional, because that's how much they would pay in co-pays, is $3,900.
Potentially.
Potentially.
Potentially, right.
Yeah.
So, you would give them the 2,000 and the 4,000 like you do today towards their deductible. Then they'd be responsible for the next 1,000
Okay.
of their $3,000 deductible, or 2,000 for family.
Unless we increased it.
Unless you increased it, you
Okay.
could say, okay, we're gonna cover the full deductible now. So somebody has met that deductible, so now they have $3,900 that is out of pocket in co-pays.
I'm not quite sure how you get to the 3,900.
So the $6,900 is your total out of pocket. Subtract out the $3,000 deductible.
Okay.
Because once you've met your deductible, then your hospitalizations, your doctor bills, those things are covered at 100%. Then you would have co-pays on your prescriptions. So let's say you take a blood pressure medication, you had, let's say you had something else and you met your deductible, but you currently take a blood pressure medication. So every time now, since you've met your deductible, and you go get that prescription, you're gonna pay, we'll say $15 copay. Until you've paid $3,900 in copays, and then all your prescriptions are covered at 100%.
So do you think MIWA is like a risky plan versus what we have?
I don't. We have, most of our groups have started to move that way because they can't afford the grandmother plans anymore, because they just kept taking increase after increase after increase since 2014. When they move to the MIWA, they get re-rated because it's a different pool, it's a different program. They look at your claims and re-rate you as a new group going into that. And so a lot of people have been able to see savings. We have groups with Anthem's MIWA. I have a couple with United Healthcare's MIWA. They all are pretty, I would say pretty similar. United, I'm not as big of a fan of theirs just because they're not as easy to work with sometimes, but like the Anthem renewals that I have this month the September renewals are coming out under single digits. So, 8%.
When we were shopped by our current broker,
Uh-huh.
Med Mutual of Ohio was the lowest.
Okay.
Okay.
Did they have you do form fire again?
We're not sure.
We don't know, we never talked to them.
I think it was just through the census that we have.
Okay, so if they just did a census quote, then those are ACA plans, which aren't going to be competitive. Were they like extremely high?
It was in that paperwork I sent you.
Yeah. I didn't print that all out.
So I'm wondering, you said you service Anthem and United Healthcare also.
I did not.
Oh, okay. Brennan Flowers does? Or does
I can, yes.
Oh, okay.
But I did not, because I was told that you guys were
Well,
interested in them.
I'm saying that it was shopped and Med Mutual of Ohio was the lowest.
I did not shop it,
Okay,
but I can.
but previously
We don't have time.
you did.
Yes, previously, we did form fire,
Okay.
and we shopped it, and at that time,
Okay.
that
Med
was still
Mutual
the
was
best
the lowest.
option.
So
Yes.
is it because of the pools for other companies or other townships or municipalities that you service that you end up with Anthem or United
Yes,
Health?
it depends on the health of the group.
Okay,
Everybody is different.
Okay.
So, we don't choose one over another. I don't make.
well, we choose.
You choose, right?
Yes,
I
yes.
don't choose for you. What I do is provide you with the information of, what are the best options out there
Okay.
and available. And, obviously, I'll give you my personal opinion. Medical Mutual is the easiest to work with. United is the most difficult, and my husband works for them. And I tell him every day. But, if United Healthcare was the plan you wanted, by all means, we would put you with them. We would put you with whatever made sense for you. Yes, in the past we did shop it, and Medical Mutual was still, at that time, the best option.
Now, if it was shopped and what was the term? Is it surveyed or based on?
Based on the census, so it's based on our names, our ages, the
Our-
family size,
okay.
your zip
Zip
code.
code,
Yeah,
all-
your zip code.
Okay,
Right.
not claim history or whatever.
Well, Medical Mutual has all your information for your claims, but the other companies do not have it. So it's based on your zip code and your age.
Okay, I think I'm answering my own question, but in the back of my mind, the question was if we ended up selecting Med Mutual as our carrier, and then we ended up with, say, 3 or 4 plans, one, the grandmothered plans, grandfathered plans, whatever, and then the MIWAs, if we were to look at Aetna, United Healthcare, Humana, whatever, and they have their own MIWAs, how would that stack up? It wasn't.
Yes, we
It
wouldn't
wasn't
know
done.
until we send out the form fire.
Right.
And that's what their requirement is.
Okay,
is that-
but based on previous history, Med Mutual Ohio, based on Form Fire, which is claims experience and so on, is they were the best selection.
Yes, at that time.
Okay.
Now, every year, the carriers change their rating. They file in July for the next year with the Ohio Department of Insurance. And, there are years where carriers buy business. I've seen it. I've seen them come in at, and more so in the larger groups, but coming in 15% below a current plan, and then the next year they get hit with a 49% renewal because what they wanted was to buy your business. And I've seen it across all of them. I won't say that there's one worse than the other, but I've seen it. They do it to meet their goals. They do it to meet their loss ratio so that they don't have to give rebates back to carrier or to clients if they hit certain loss ratio numbers. I could go on about my opinion on it, but we'd be here all night. So, but if you could, so I did not email this one over because I didn't want to make it more confusing. But you could keep that grandmothered plan and make a plan change within there. So you have the option, you could increase your deductible to $4,000 and $8,000, which would bring the renewal increase down to 5.19. Or you could increase it to $5,000 and $10,000, which brings the renewal down to 5.5% below your current rates. So that's an option if you were nervous about making that switch to the MIWA this year. Staying with that grandmother plan and then increasing the deductible and then adjusting your HRA accordingly if you wanted to.
But by doing that with the higher deductibles and so on, we may end up putting more money into an HRA account.
You would.
Which is probably double digits increase.
No, it's not. So estimating, obviously it wouldn't be, that 70%, but really you're only adding another 1,000 or 2,000 per person. So
If we went from a 3.6 to a 5.10.
If you went to a 5.10, then that would be more.
Yeah.
But if you did the 4.8 and you funded 3,000 and 6,000, that's only adding 1,000 for single coverage and 2,000 for family coverage.
Right.
So instead of $60,000 maximum liability, it's $90,000. Again, it's $30,000 you have to appropriate for, but it's unlikely that you're never going to hit that. Where it's easier to say in my budget, I have an extra $30,000 than saying I have $177,000,
Right.
right?
Yeah.
So that's a 4,000, 8,000?
Yeah, here, I'll give this to you.
I
so
like
you
that
have
idea.
it too. I just didn't want to make it more confusing.
So then we could just do the employer-funded
Thank you.
HRA at 3,000, 6,000?
Mhm.
Thank you.
You're welcome.
And that's a 6, it's a 5 to 6.5%.
So then that
increase.
what would that increase our, oh, never mind, you gave it to me, out-of-pocket max.
What's another 30,000 to put in the HRA account? Plus, I don't know which number to read, the estimated annual difference or the
So the
estimated annual difference, two different columns. One
the-
would say
the third
5.9
column.
and one says 6.59.
Yep, the 6.59 would be if you did the 4,000 and 8,000.
Right.
And I think I did.
And that's still grandmother.
And that's still grandmother. And
Yes.
so I showed the utilization at 60%.
That grandmother, I'm always afraid to jump.
60% might be high, or it might be, currently if you're around 69%.
But this doesn't go into the, once you met your deductible, the prescriptions go.
Correct. Once
Okay.
you met your deductible, you have 100%
I like
coverage on
I like
everything.
this better.
Yeah, I do too.
I'm very
Yeah, I'm
comfortable
surprised
with
And
I
it's
didn't
back in the
show you making a
6%
plan
kind of
change,
raise,
'cause-
not
Well, I think-
18% or whatever.
I think in the past, we weren't interested in the plan
Got ya,
change.
yeah.
So it's
But
not
now
his
we're kinda-
fault, it's
Sure,
just-
sure, yeah.
Yeah.
Yeah, so those are the next two options that, and 5,000 and 10,000 is as high as the deductible goes in the grandmothered plans. But I just put it on there so you could see those differences.
Quick question.
Yeah.
The estimated annual plan cost.
Yeah.
That line on both pages.
Mhm.
So does that take into consideration the additional amount we would have to put into the HRA?
So the estimated plan cost would be your annual premium plus the estimated utilization.
So that would take the
So,
HRA cost
yeah, so
into
that would
account.
assume, that, let's say 60% utilization or whatever percentage utilization. The maximum plan cost right above, so like on the 4,000, 8,000, that 437,000,
11
that is your annual premium plus if every single person uses their deductible. So that's what you have to budget for.
Got it.
This first column, is that where we are now?
That's the current, yeah.
Okay, that's what I want to know.
Yeah, as of until the end of this month.
I see it's written there in red, I couldn't see it. Sorry. But that, relative to where we are now, that's another, call it 10 and 37, $47,000 to cover the total liability.
On the plan.
The change in plan to the 4.8 and the HRA.
From where you are today.
Yes.
Yeah.
So I'm still a little confused, sorry.
It's okay.
I'm confused with what Kent just said.
So if my goal, my hopeful goal would be, number one, that our employees can keep their same physicians.
Uh-huh.
They don't have to jump ship.
That's important.
Do that.
Second goal is that the employees, their out-of-pocket costs are consistent from this year to next year. And then the third goal is the lowest cost to the township. So which of these, which number am I supposed to be focused on? Is it
That's good.
is it column 3 on page 1 or column
So-
3 on page 2?
On the MIWA option,
Mm-hmm.
if you want to keep the employees out of pocket the same, you're gonna wanna look at column 3.
Yep. Okay.
If you want to keep the employees out of pocket the same, either one on option, or on the second page, option 1 or 2 keeps their out of pocket the same.
Okay.
Again, that estimated utilization is a roll of the dice, because we don't know how much more somebody is gonna spend. You know, when I was looking at those reports, it's not consistent of, you know, everybody, you can usually see, okay, so-and-so every single year hits their deductible, so you know something's going on. It's not that consistent for you guys. You know, there might have been somebody that used it one year and didn't the next two, and then did the next one. And that can be because of a surgery or having a baby or, you know, anything like that. So these are, again, estimates, but either one of those would keep that out of pocket the same of the 1,000 or 2,000. Your fixed cost, your monthly premium, the lowest one is going to be that 5,000 and 10,000 deductible on this, actually between both sheets, the MIWA or this.
Keeping the same employee out of pocket.
Yes, of that 1,000 and 2,000.
Okay.
So your fixed cost is that monthly premium that you're going to pay every single month. That's the one number that I tell people to really focus on, because you know that's the guarantee. Now, obviously, it'll change if you hire new people or people leave. You know, that number could fluctuate. And then the next is, you know, the maximum liability. So if you did the 4,000 and 8,000, the maximum liability is 90,000. If you did the 5 or 10, the maximum liability is the 120,000. So you just have to be able to show in your budget that you would have that in the event something catastrophic happens and every single person hits their deductible, which we know won't. Unless there's like a nuclear bomb or something. So I guess we won't say never.
So if column, like the option number 2 on the page you just handed out,
Yep.
has the lowest monthly premium of the 3 choices, and it has the lowest maximum.
So here's
Am I
Lowest
reading that
maximum
right?
cost.
here's
Yeah,
another
has the
thing
lowest
that you
maximum
should look
cost.
at. Look at the maximum plan cost line. And so this is going to be the total of your annual premium, plus if everybody would hit that deductible, what your liability is. So currently, you're at $389,000 and odd dollars. Your renewal, if you stayed the same, your maximum cost is $448,957. If you make the plan change to the 4,000, your liability maximum drops down to $437,000. If you do the 5 and 10,000, it drops down to $431,000.
Yep.
So that's what has to be budgeted for.
Okay, but if you look at that last column and look at the estimated annual plan cost, the next to the last line on the page versus what we're paying now, it's only an increase of $7,000.
Right. And again, it's an estimate, so
Yep.
if somebody gets really sick or multiple people get really sick and the utilization is higher than what we estimated.
But again, I'm sorry to beat a dead horse,
Nope.
but the maximum plan cost would already bake in the HRA.
Right,
Yes,
Budget.
yes,
Maxed
so
out.
that's the budgeted number.
maxed out.
Okay. Here's
And
an
I used, I wanted to make sure I was doing it.
off the wall question.
Yeah.
If we were to commit to 3 years, could we lock into a rate?
No, they won't do that for small
Nobody
groups.
does that?
Not for small groups. I can't even get a 2-year rate on our larger groups. The most I've ever gotten on a large group is 15 months. But small groups, it's just always. And when I say a larger group, that's one that has 50 to 100 employees.
That's starting to look really good to me.
Yeah.
All
I
you're doing
wish I
is,
could
is
get
all
you
you're
something
doing.
like that. That'd make my
all
job
you're
really
doing is
Med
optics.
Mutual,
is-
grandmother.
It's just,
Yeah.
all you're doing is
Okay.
optics on the,
I'm worried
the
about
high
my
deductible.
grandmother, because I lived
Yeah.
through the last time.
And if the township makes up for it to keep the out-of-pocket. I think it's the way to go.
What do you think, Mr. Fiscal Officer? Are you satisfied with that?
Yes, it's much better.
1.93%.
That's much better than
Mm-hmm.
Yeah.
what the
Thank you for coming in
keeping
and
the
talking to
grandmother.
us.
Yeah.
Yeah, no problem.
Well, it is grandmother.
Yeah.
It is.
But I mean the original quote,
Oh,
yeah,
Yeah.
on the grandmother.
Okay.
option
Yeah.
1 of 9. Yeah.
Yeah,
And then, you know, do you,
So which one are we
what's your
looking at?
contributions
Or
for the
510.
payroll? Or the premium, like the payroll deduction, do they pay anything? Okay. I was gonna say, by doing that, it reduces their costs, but it won't
4,000.
because they don't pay it.
Right.
Yeah.
see, and that's another thing you could do.
Maximum cost.
You could factor it that there is some cost associated to the employee. You
Yeah,
could
you-
structure it that way
You
too.
could also do that, yeah. By law, you have to pay at minimum 50% of the single rate. You don't ever have to pay towards somebody's spouse or dependents, if that would be, but to be honest, none of my townships or villages or cities do anything like that. So, I have a few that now do the spousal carve out. So they say if, you know, your spouse is employed and he or she is offered coverage through their employer, they have to take that and not be on the township plan.
You kick them off our plan.
Yeah, and usually that's the larger ones that are doing that, and some of them do it strategically because they know somebody's spouse is not healthy.
I work-
And
I worked for a company that paid me for my spouse to be on their own.
Yep, a lot of people do that too.
Fire department used to do that.
Yeah, my brother-in-law works for Licking County as a sheriff's deputy, and they pay him through a flex account if he goes on my
Either
sister's
one of
money.
those.
So we need to reference this plan number. Is that that seems to be the unique title?
Yeah, I would say that's how they list it in the
P5000,
renewal.
10,000.
Is that the one you guys want to do? 5,000, 10,000?
No, we want to do the 4.8.
No, we're talking about the,
I'd like to do this
Network
510.
number. Oh, okay.
because it meets all the criteria, it's the lowest.
Yep. It says that you reduce your premiums and you sock it away over here in the HRA to draw against.
So there's no.
But the total
With the
out of
employees.
pocket is less.
Right.
Yeah, I like that.
It's still grandmother.
And hopefully they don't ever do away with those, but if they do, we know that there's other options now. You know, prior to the last couple years, there haven't been other options, and it was, if the government takes that away from you, it's really gonna bankrupt some people, as far as businesses go that have to offer, you know, this so-called Affordable Care Act. The premiums are ridiculous and the plans are bad. They're high deductibles. I don't know who said anybody could afford $13,000 out-of-pocket maximum if something bad happens, right?
Okay. If we look into this program and say somebody goes off the township and then they're eligible for COBRA, that,
So you don't have over 20 employees, am I correct?
That's
So there's
correct.
no COBRA.
oh,
You have to have
Right.
20 or more
Is that right?
employees to offer COBRA.
we offered COBRA to a couple employees in the past, right? But we didn't to the most recent one?
Not since I've been here, you haven't.
Okay. But we did prior to that.
Now
I have
there's
no idea what you did prior to me being here,
Okay.
but I know that since I've been here,
You're
there's
pleading
been no
ignorance, I
COBRA.
understand.
So, there is a such thing called mini COBRA, and
Okay.
they also call it state continuation. So if somebody loses, their benefits involuntarily,
Involuntarily, okay.
then they can have, they have this mini COBRA, which you collect, that there's no administrator, you as the township administer that. So let's say you let somebody go, you laid somebody off, they're no longer, their position's no longer available, you could offer them mini COBRA, and it's shorter amount of time than regular COBRA is, that they're allowed those benefits. They have to pay you directly, in order to keep that.
Okay.
In my opinion, it's kind of a pain.
Yeah, it's an outlier. I just
so-
asked for
Yeah.
follow through.
Yeah, yeah, so if you got in that bind and somebody questioned you and asked about mini COBRA, you know, we
Okay.
could help you out.
Let's talk for a moment about if we switch plans, when would it be effective, and how does that affect our family deductibles for this year?
So it would be effective for August 1st, so in
Okay.
a couple weeks. And basically, if somebody had met their $3,000 deductible, Medical Mutual is going to say now they have $2,000 more deductible for the rest of the year. So it doesn't start over in August, because the deductibles run January to December 31st.
Okay, but then you have to file for HRA
So
reimbursement.
yes, we would adjust the HRA
Okay.
to compensate, you know, that amount. So I think Kim said are you able to get a report of what people's balances currently
Yeah,
are?
the one I sent you
Uh-huh.
in the email, those
Yep.
are the current balances
Okay.
as of
Yeah.
July 15th.
Okay, okay. So what we'll probably do is have you get
You're
another
over the
one.
amount, so I would assume you did.
What I would recommend is probably you get another one on the 31st or
Okay.
on August 1st.
Yeah, they sent them to us weekly, just like you guys
Oh, okay,
did.
okay.
Yeah.
Yeah, so then we can adjust them. We'll set everybody up and then adjust them. And then once any run out claims, are they gonna handle run out or do you?
Yeah,
want
they'll
us
do the 3-month run out, so
Okay.
anybody up until August 1st, they'll have to submit just like we did before.
Okay, yep, yep. So then we'll just probably ask after those 3 months, at the end of that, if another report to make sure that there aren't any major adjustments.
Okay.
There probably wouldn't be, unless you know of somebody that's had a major surgery in the last month or so that hasn't gotten bills. Have you gotten your bills?
I just got a bill for $1,800.
I got
So-
some pending for a couple thousand.
Okay, so we'll keep an eye on it, and, but what we would do is just adjust everybody's HRA balance to include that additional amount. And then we'll adjust them again if we need to after that run out period.
Okay, so which one of the 3 resolutions do we specify the plan?
I don't have a resolution for what we just talked about, so.
So we can
Does it
approve
say
it with
specifically in
edits?
there?
Yeah, it has all
Okay,
the
it was very
premiums listed
specific,
and
right?
it lists the HRA, so we would have to
Okay.
completely, I mean, I can cross it out
Mm-hmm.
and,
We're gonna have to.
do you happen to have the premiums for that?
I do, yep.
I mean, I can handwrite them on here and then I can redo it, if you want me to do it that way.
Well, we need to take action before the first.
Right, but what I'm saying is for right now, like I can handwrite it on, like cross these out and put it on here and have you guys sign it, and then I can clean it up and just have you re-sign it or whatever. If that's,
Yeah.
We're looking at probably the
So
alternate.
it's the first one. It's 81.
10,000, right? Or you want to do the 4.8?
It's resolution 81.
510, I think that's what we're talking about.
There is, do you want me to read them to you? Is that easier?
So the Medicare.
Medicare person is $732.52.
Okay, employee only.
$737.52.
Employee plus spouse.
$1470.04.
Because you're looking at this, does it say this?
Employee plus child.
$952.90.
It will still say this one.
Employee spouse child.
That's what I was asking.
Child $1685.42.
From the bottom.
1685. Yep.
That's what
42.
we have the budget for.
Employee spouse, 2 children.
So that's maximum.
$1,480.
Okay.
Employee spouse, 3 children. 2202.
No, I think you have to budget for the maximum, so the line up
Okay, so
above
then
it.
that will
Right.
change the HRA.
431.
The HRA
Okay.
will change.
You have to budget for that
So it'd be
one.
the 2,000, 4,000.
Yeah, you have to budget for 431, which is the lowest on the page.
Yeah, yeah, yep, you're right,
Okay.
Yep.
But the
Maximum.
estimated annual
That's the
cost is down below.
right.
Okay, that's all I need
Is that
to
all you
change.
need?
Yep.
Okay.
383.
So
And
you're,
then,
also, Jody, if you look at the
When
premiums
you-
are down
Whenever.
per month,
Just
and
before the
all
first,
you're
you'll have
doing
to
is putting
sign
more
and
money in the
this.
HRA
I already
account.
wrote the plan in there, and then we'll need that agent of record letter.
But the
Okay.
total is less.
So the estimated cost.
Do you want this?
This
Yes,
page,
if you don't mind. No.
This page, it's 401, or it's 383.
Thanks. Yeah.
Which one you modifying, 81 or 81 alternate?
I did 5,000, 10,000.
That's the
Which
last one.
resolution were you modifying?
The 81 that's not the alt.
Okay. That's what I asked.
So it'll be the one that spells
Gotcha.
out
Mm-hmm.
It's fine.
employee, employee spouse, employee
I
child,
can just,
employee.
I can just get rid of this one because it had the same
Yes,
thing
get
on
rid of the
it.
one that says alt on it.
Okay.
Too many papers.
Okay. Ready, any other discussion?
Did you guys want to talk about dental vision?
When do we need to change to that?
So
That's
you don't.
September
So
1st.
here, my recommendation is probably for you to stay with principal because their rates are better than our consortium plan.
Okay.
They're a little bit different as far as the benefits go. So on the dental, our plan that matches the closest would be a 2% increase over what you're paying today. I don't know, 2% is not a lot, but you know, it's not my money, it's the taxpayer money, so you guys need to make that decision. It does offer a little bit better benefit if you go to a PPO dentist versus a non-participating dentist, where your current plan, it doesn't matter what if your dentist is in the network or not.
Well, once again, we're interested in keeping our same providers.
Sure. And I don't think you would see any issues between Delta and, because you had Delta before
Right.
and Principal, but there could be somebody's dentist might have been in Delta that's not in Principal or vice versa.
The only major problem we had is with Jody's, because the county has the same exact plan and they always mixed it up.
Gaia. With the Delta.
Yep.
Yes, I get that a lot from people. You know, their spouse works and they have both coverages, and I don't know what that is with their system. but
Every year,
yeah.
I would have to
That's a
call
nightmare.
them, and they had to create like a dummy account just for us
And that's
to,
not worth it. Like,
yeah.
yeah, I mean,
So
again, it's a little bit more premium, but if people are happy with Principal, we can still be the broker for that. We write all carriers, so it doesn't matter.
But
to
on
us.
the vision though, you guys have your own, so how would that work?
So the vision is with VSP, and it's higher than what you guys, we don't have a plan that matches.
Yeah, we still use the same
Still use-
network.
Yes.
Yeah.
So, with Principal, you guys have a $10 copay for the exam and the lenses. The frame allowance is $130. With us, our plan with VSP is $15 copays. Our allowance is more of $150 or $170, but it's almost a 6% increase. So it's not a lot of dollars. It's $153.
What about the voluntary?
Voluntary, so
Because we have a lot of our employees that
I
choose
would
to do
keep
the
that.
voluntary,
yeah.
and then it's already automatically payroll deducted.
I will tell you, switching voluntary is a pain in the butt. It is, because nobody's the same. Nobody's rates are the same. Everybody's different. If it's working, I wouldn't switch it, to be honest.
Okay, so are we hearing you say, like, you could still be our broker for all the principal stuff
Yeah.
we have?
Yeah.
Okay, and you would be okay with that?
Yeah. Oh, yeah.
Okay.
Yeah. We're licensed with them, so
Okay.
That's not an issue. And I don't ever steer somebody one way, or, like, I wouldn't say, you need to move to our VSP plan, and pay $150 more a year. Like, that's just dumb.
Okay.
Right? And have higher copays, that's dumb. So. It usually doesn't happen that we see other carrier plans be, but they just might have better rating in this area
Yeah.
with Principal than VSP and Delta has, so. And then your life and that disability and stuff is all with Principal. I would just keep it all the same because it's all in one bill.
Yeah, it is not, I will tell you, it's nice that way, because then I
Yes.
just go in, I log on, and I pay one bill, and it's over.
Yeah, and you don't have first responders on the plan, correct?
Nope.
So the only benefit to the consortium plan, life plan that we have offers a line of duty benefit. So that would be my only recommendation, to make that switch with the life, to give them that added benefit, but since there are none, it's not worth it.
Okay. So your resolutions are gonna take out the dental, vision, life, and disability?
We'll do that at the next meeting. We don't have that
We
one on
don't-
this one.
No, I thought in,
81 is just for medical.
okay.
What about 82?
82 is for the actual broker, and then 84 is for the HRA.
But in the title of 82, it says for dental, life, and vision.
Yeah, for the broker.
Oh, yeah, you're gonna broker. Got it. Okay, I'm about a week behind.
But since our dental and vision
Got
don't
it.
renew until September 1, I was going to bring that to the August meeting.
Oh,
Okay.
yeah, that's.
And Phil's not gonna vote on that.
Did
I'm
you
in
get a
favor.
rate increase on those?
Only the dental. So dental, it's 4.9% increase.
Yeah.
It's like pulling a tooth.
No, honey.
But everything else stayed the same.
Well, that's good. Usually, I was gonna say, usually if you get an increase, it's on dental, because
Yeah.
that's something that people utilize, especially if you have kids on the plan. I got 2 increases.
Okay, so do I need to add the HSA P 5,000, 10,000 to what I read originally?
Kim?
No.
Doesn't change in the title.
It doesn't change the title. The only thing that changed was section 2 with the new rates, and then section 4 with the HRA rate.
So the title doesn't change.
Yeah, the title stays the same.
Okay, so roll call.
Ms. Lees,
Aye.
Mr. Bryant,
Aye.
Mr. Beck.
Aye.
I move approval of Resolution G 2022-82, resolution authorizing the Township Administrator to change healthcare brokers and sign an agreement with Burnham and Flower for medical, dental, life, vision benefits for elected officials and employees of Symmes Township.
Second.
Discussion? Roll call?
Mr. Bryant,
Aye.
Mr. Beck,
Aye.
Ms. Lees.
Aye. I move approval of Resolution G 2022-84, resolution authorizing the Township Administrator to change health reimbursement account providers and to sign an agreement with Burnham and Flower for HRA benefits for the elected officials, employees of Symmes Township.
Second.
Discussion?
The only thing will need you guys to tell Michelle is what exactly do you want the HRA to pay for and
Yeah.
reimburse?
So let's talk about that.
Doctors and prescriptions.
If you only want it for doctors and prescriptions, that's totally fine, that's what we will do. I think originally, this is what Courtney in my office said, that originally, way back in, I think it was like 2016 or 17, when the plan was set up, it was set up as an HSA account instead of an HRA account. And so that allowed for other things to go through, like dental and vision and.
We had both.
So,
We had HRA and HSA, and then we switched them all to HRA.
yes. And so what happened was that didn't get switched in the system, so that still allowed people to use it for dental and vision.
Oh, that makes that work, because the original paperwork just says network only expenses.
Yes. Yeah, so now, the system, she can go in there and state that it can only be used for medical providers and prescription pharmacies.
Okay.
So if somebody did try to swipe it at an eye doctor or a dental office, it will get declined. Now, if somebody, let's say, has to have cataract surgery, cataracts is covered under your medical, but it's done by a ophthalmologist.
Right.
And so their system coding and their credit card reader, it will decline. And I use that because I get this question a lot. If somebody has that situation come up, we can override the system for that one person in that one provider's office.
So same with an oral surgeon?
Same with oral surgery, if it's medically necessary.
If it's
Okay.
wisdom teeth.
Okay.
If the medical insurance is covering it, or if it's going towards your medical deductible, then yes, a dentist, we can override. I don't know.
Because
if
it's surgery.
Yeah. Sometimes they cover those under medical and sometimes they don't. They say it has to be medically necessary. It has to be causing a medical concern.
Does it require
to-
pre-approval?
Yes, typically.
Okay.
So like I had a kid that had a tooth not coming in. They had to go in and put him under and scrape his gums to put a brace on it and pull that tooth down. That's cosmetic. They weren't going to cover that because it wasn't causing like sleep apnea or something. Yeah, I'm just throwing out a random condition. But yeah, so our medical didn't cover it. We had to do it under our dental.
So the only thing left is dental and vision copays?
Yes. So those
Okay.
would be the employee's responsibility.
Okay.
They would not get those through their HRA. Now, you can make it so that they can if you would want to. I mean, I have townships that say, I have one township, and I think this is ridiculous, but they give every employee $15,000 in their HRA and say, go use it for what you need. Medical, dental, vision, over-the-counters.
15,000 per year.
15,000 per person.
Per year.
Per year. Which is stupid.
I thought it couldn't exceed the cost of your base plan.
The HRAs don't matter. So
Oh.
that's different.
You said something a minute ago, Kim, about network.
Yeah, the original thing in 2016, I pulled it because I went back and looked at the records. It says in-network
In-network
expenses
only.
only.
Yeah.
Okay, so we can't get reimbursed
For
out of any,
out-of-network, so you'll have to specify that, I think, or
Oh.
does that matter?
Yes, we will specify that.
Okay.
in-network
What's
or
that mean,
out-of-network.
yes or no? Out of
No,
network?
you cannot get reimbursed for out-of-network, which I
For
don't think.
for anything?
Right, I don't think many people would have an out-of-network provider.
Medical?
Yeah.
I'm doing it now. I'm fighting with the Med Mutual, the place that my physical therapy is in network, and they say it's not.
Oh, well, that's dumb.
Yeah, I know, especially when I can go to the book and see my
And see them in
PT's
there.
guy's name there.
Right.
But
Is
it's
it
been appealed and declined second time.
And the only reason I asked is because I think on one of the things, like, I think our health insurance now allows for out-of-network, but it's
You can do-
it's 50% versus 40%, or whatever that.
Yeah, so you could do that. You can add to cover for out-of-network. It's whatever you guys
Well,
want.
that's a question.
That's not, that's
Jody,
not
that
us
should be
saying.
of prime interest to you. If your kids are going out of network,
Yeah, because like kids out of town will automatically be
Yeah.
out-of-network, so.
Right.
So, well, they're changing
As long
their,
as you're-
right now they use Aetna's network for out-of-state, and they're changing it to Cigna's network in January.
They come home and go to the doctor right now.
Yeah, see, right now on this line item, it says, here, let me show you. It says 40%, but if you do this is just the Cozy Meal, I don't know about the other.
Oh,
ones.
what
It
they're,
goes to 50%.
yes.
So this line item here,
Yes.
co-insurance,
I will-
in-network, out-of-network, 0, 40%, or 0, 50%.
Yes, so currently, they don't put them on, I can pull the full benefit summary, but I believe it's 50%. The deductible gets higher. Right.
Yeah.
And the out-of-pocket, and then it's 50%. So that's still the
right now-
same
right-
on that plan.
Right now, we're at a 2,000, 4,000,
Yes.
okay? And then when you look at out-of-network,
It's higher.
yeah.
It's like 10 and 20 or something
Well,
crazy.
let's say at least 5 and 10, or
Yeah.
6 and 12, or something.
Let's see if they put it.
And all of a sudden, I'm getting bills that are in-network that are being billed as out-of-network.
Yeah, they don't list the out-of-network in the renewal, but I can pull the full benefit summary and find out what the out-of-network benefits are.
It's gonna go up, right?
It does, so it goes
No, I
up a
mean,
little
from the,
bit.
from
the-
whatever it is now, if we go to a 510, it's gonna be probably 1020.
It might be. But if you want to include that reimbursement in your HRA, you can do that.
I think you want that.
Okay.
But here's another situation. So if you're saying we're gonna give, what did we say? 4,000 for single, 8,000 for family, towards that 5,000 and 10,000.
Okay.
But you use $4,000 towards your out-of-network provider that they claim is out-of-network.
I supposedly met in-network before the total deductible before I ever went to PT.
Okay, but let's say in January, when your deductible starts over in January,
Right.
let's say you spend all $4,000 towards this out-of-network provider, and something happens and you have to have your gallbladder removed, and you do it at an in-network facility, you have that that $5,000 deductible to meet, but you no longer have $4,000 in your HRA because you used it for an out-of-network provider.
That's okay.
Does that make? So then it's on you, you
Yeah.
know? So you either pay for it
I'm looking for.
first or second, or, you know.
Yeah.
But
Yeah.
people will freak out if that happens to them. I see it a lot, like if they use it for, we see it a lot when people go to the chiropractor, because the chiropractor says, oh, you need to come see us 36 times. Well, they only cover 12 visits. So we're gonna set you up on a payment plan. So you pay us $135 a month, and they give that Burnham Flower debit card, and they pay $135 a month. And then all of a sudden they fell and they broke their leg and had to go to the emergency room, but they have no money left because they paid more than the visits were covered.
So what you're saying is
So-
out of pocket can really climb.
It can,
That's-
yes.
Especially if you do
Yes.
anything out of network.
But if you want to do cover out of network, that is 100% your decision.
I don't need it. I mean, I'm fighting something that's in network, they're saying is out and I appealed.
What does the physical therapist say? Do they say they're
They said we're in network, they just,
Yeah.
and I've
Must be
talked to the
something
billing
in their
department for
system.
them, and I talked to Med Mutual.
Mm-hmm.
And I appealed Med Mutual, and I said, look, this guy's in your book, you know?
Yeah.
And I think it has to do with the company billing under their name, not under his.
That sometimes happens when it's a larger
And I'm trying to get both of
entity.
them to reconcile that.
Mhm. What a mess. I find, I was trying to find a psychologist for my kid, and I can never find one in network with.
Well, and I
any-
think that's the biggest question I've heard is,
Yeah.
you know, it usually has to center around that,
It's-
and if that person is usually not in network.
Uh-huh, yep, I'm paying out of network for my kid to see a psychologist so that we can deal with COVID, mental health, non-normal school years issues.
That's tough.
why premium's going up.
Okay, so are we covering out of network? Is that what we're doing?
Well, I don't think I need it. I'm just saying that with your particular situation, where you get kids all over the country, it's something that should be discussed and we have to decide.
So for the kids, if they are out of state and they go to an Aetna, currently it's Aetna, if they go to an Aetna provider, that's considered a network.
And that's fine. So what if, like, my daughter, if she goes to like an emergency room or
Uh-huh.
something because she thinks that she's having a heart attack or something?
Yep.
I don't know.
Yep.
Is that like
Emergency is always covered as in-network.
Okay.
If it's a true emergency. Now, if she goes into the emergency room because she thinks she's having a heart attack and they said, did you eat Chipotle tonight and you're having heartburn, that's not a true emergency, we're not covering it. But if they hook her up to a monitor and they run all these tests and, you know, then yeah, it's gonna be covered.
But she comes home and goes to the doctor, so that's
Yeah.
like.
You know, you're on vacation, you fall and slice your foot open on the beach, you need stitches, you go to an emergency room, it's covered as a network.
Okay.
We have not been out-of-network deductibles do not qualify for HRA reimbursement. Is that right? Currently?
What's that? Currently, I believe it's probably just in-network, that's covered for your.
Reimbursement through the HRA doesn't cover out-of-network, or it does?
I have no idea. I don't, like I said, for the first 5 years that I was here, I only thought it was medical and prescriptions. I didn't know you could use it for anything else.
No,
I
it's
didn't
still
know that.
medical and prescriptions, but what if it's out-of-network?
I have no idea. I don't go out of network, so I don't know the answer to that.
I think you're the only one going out of network.
Well, I don't want to.
He's a rebel.
I never want to. But the point is that,
Here's
wait a minute, HRAs are paid by EOB, right?
Yes.
Okay?
Yeah.
And if you have an EOB where your responsibility is listed and you're under HRA max reimbursement, you'll reimburse it. Okay?
And not with the company that we just came from, Church Schneider. They would not do that.
All right,
So here's the thing, if you set it up now to say in-network only, and somebody comes, let's say your situation doesn't get resolved through appeals, even though it should, but let's say it doesn't, or there's somebody else, somebody in my situation has a kid that needs to go to a psychologist, and the only person I can get him into is out of network. We can make an exception, we can make changes anytime, so.
But it takes legislation for us to make that change.
I think we should just put it in and put it out there. Because,
Well, yeah. Well, Phil's going to Europe, and if something happened to one of him or his children and they needed air care and so on,
Well, she said that's an emergency.
That would be an emergency. Air care though is totally.
and it's whatever they want to charge.
It is, and they don't contract with anybody.
Yeah. We just, the company I worked for before this township actually had separate insurance for that kind of thing.
Yeah, you can buy
Yeah.
for that trip.
So,
Right.
I'm not trying to be a butt here, but we have another meeting coming in at 7 o'clock, so we gotta like make a decision and roll out of here.
Okay, what's the recommendation?
I think we
In
should
network
just cover
only?
it.
I mean,
Be
it's
safe.
probably,
It's not gonna happen.
it's not gonna, like I said, it's
But I
not
think
gonna.
it's
Probably gonna be very slim to none that it'll
Slim,
happen, but.
yes, yes. And as long as somebody knows, okay, yes, I have to go to this doctor and I know that they're out of network, and if I use my HRA money, I'm not going to have it if there's an event.
Right. Okay, so I think we should include it.
Okay.
All right. So, new business, we have none. So I move.
Wait, we still have
we
to
haven't
vote
done-
on
we haven't done-
Oh, did we not
84.
vote on that last one?
So
I
Barry,
already
just want to
thought we did.
make sure that's clear. It's medical prescription, and which includes out-of-network costs. So, does that include, like in your medical, I'm not sure, Phil, you had a question once, what about inhalers? Do inhalers get included in that?
So if it's through a prescription, yes.
Okay, but if
Yep.
it's not the prescription, then the answer is no?
Correct. If it's like an
Over the
over-the-counter,
Okay.
then no.
Yeah, they're
So,
all prescription covered.
like, let's say doctor says you need to take allergy meds, all allergy meds are over the counter, they're not going towards your deductible.
Right.
So then it does not cover. Now, you could set up a flexible spending accounts if that's something you wanted to look at doing, and that's where the employees put money in from their checks each
On
pay.
top of the other?
On top of the other, and then they could use that for dental, vision, over-the-counter stuff, acupuncture, I mean, it's a whole list of things. I wouldn't recommend doing it now. I would say if you wanted to do something like that, roll it out in January.
You probably
Okay.
need to get some experiences to find out how much you want to put into that thing anyway, because it's use it or lose
Yes.
it.
Yes, it is. It's a kind of now. It's they allow you to roll over $500 each year now.
Okay.
But it is, it's set by the government how much money you can put in there. But they could use it for braces for their kids. They can use it for eyeglasses, contacts, any of those
Hearing aids.
types of things. Hearing aids, yeah, absolutely. I mean, the list goes on. If, let's say somebody has cancer and they want to get a wig, you can use it for that.
So dermatologists would be included in medical?
Yes,
Yes.
yes.
All right. So I guess roll call.
Mr. Beck?
Aye.
Mr. Lees?
Aye.
Mr. Bryan?
Aye.
Okay, we have no executive session, so I move to adjourn.
Second.
Roll call.
Ms. Lees?
Aye.
Mr. Bryan?
Aye.
Mr. Beck?
Aye.